If your doctor has just handed you a prescription of prednisone, you probably have a lot of questions. Will it make you lose sleep? Why are you suddenly so hungry? But most of those side effects are manageable if you know they are coming. I have put together this survival guide for steroids so you can get the relief you need without being blindsided by those side effects. Hello, all of you rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Rheum Doc, as well as a practicing rheumatologist here at Empower Arthritis and Rheumatology Center. Today, I'm going over some of the common side effects, what you can expect, and how to manage those side effects. Please stick around. Before I go further, don't forget to like and subscribe to our channel so that you can get these contents whenever we come up with new videos. And that can also help other RA warriors to find these content. And also don't forget to accept our gifts. And we have two gifts in our channel. The first one being the full copy, the whole copy of a book, the Holistic Rheumatoid Arthritis Guide, that you can find in the description below. And this contains all the required information that you need regarding rheumatoid arthritis. And we have also created a recipe for anti-inflammatory smoothie that you can create every morning to fight against rheumatoid arthritis, so that you even don't need to reach to that prednisone. As we have discussed in our prior videos, steroid is a powerful tool. It's a powerful relief when you are having an acute flare of rheumatoid arthritis, or when you are initially diagnosed with RA and you are waiting for those long-term medication to kick in. It can help you feel better faster. But steroids are double-edged sword. They can help you feel better faster, but they can come with some potential challenges and side effects. That's why it's so essential for you to understand better about what are those side effects, so that you can expect those side effects and help you manage them proactively. So understanding these symptoms and the side effects help you better manage those side effects. And if you understand those better, you can effectively communicate with your rheumatologist who have prescribed you those steroids, and they can help you guide how can effectively manage those side effects. So it will help you get empowered to manage it effectively and better. Now, going detail on the side effects, I have categorized them into two different categories. One is the immediate side effects that you can expect within few hours to days of starting these steroids. And I have categorized them into four different types of immediate side effects. Number one being unusual appetite and increased weight gain. Number two, the mood swings, those irritability, the anxiety, and the sleepless nights. Number three, the fluid retention and swelling. And then number four, the upset stomach or heartburn due to gastric irritation. So these four side effects are the most immediate side effects. And many of you might remember, when your doctor put you on steroid, you might be reaching to your fridge to get those ice cream. And you are not alone. And it's because of the steroid, because it increases your appetite for more high carbohydrate and sugary food. And that can lead to increased weight gain. And the mood changes are also common with steroids. It can make you more irritable. Your anxiety or depression might get worse. And on top, your sleep might be affected too. That's why your doctor typically recommends you to take steroid in the morning so that it may not affect your sleep. Many of our rheumatoid arthritis warriors, when they start taking steroid, they feel more increased weight and fluid retention and swelling in their legs. And that's because of unusual fluid retention by those steroids. And those steroids can also upset your stomach, that can irritate the lining of your stomach, causing gastritis. If you already have gastritis, even it can increase your risk of bleeding ulcers. So always be careful with those side effects. Now, you might ask, how do I get relief from these side effects? So let me start with the first one, the increased appetite and weight gain. To minimize this, to decrease your unnecessary extra weight, here are three important tools that you can use. The first one is watch out what you are eating. Focus on nutrient-dense, whole food rather than refined food. And try smaller and more frequent meals throughout the day. And also keep a healthy snacks handy for you, like the nuts and the veggies rather than those sweets. So try to stay away from those sweets and keep those high fiber, dense food close to you so that if you feel hungry, you can use that food, which is less likely to cause increased weight. Now, the next side effects, that is the immediate side effect, is the stomach upset. And to protect the stomach upset, you can do those 3 things listed here. And the number 1 being always take the steroid with food or a glass of milk. That can help protect your gastric lining. While you are taking steroid, also try to minimize spicy food and highly acidic food, which can further irritate your stomach. And the third is you can also discuss with your doctor if you need some protective medication like antacids or other medication that can help reduce acidity in your stomach. So discuss with your rheumatologist if in case you need those type of medication to minimize the gastric irritation. Particularly if you have prior history of gastritis or bleeding ulcers, it's much more important for you to be taking those medications that can protect your stomach from gastric irritation. Now, the other 2 immediate side effects that we talk about, fluid retention and mood swing, I'll help you guide on how to manage those. For fluid retention, try to reduce the amount of sodium you are taking. If you take excessive sodium along with your steroid, it further increases fluid retention. So try to minimize sodium when you are taking steroids. And always stay hydrated throughout the day. If you are not hydrated, it can make things worse. And if you have any swelling of your leg, try to elevate your leg, particularly when you are sitting down. That can minimize the swelling in your legs. Now, related with the mood swing and sleep, here are 3 things that you can do. Number 1, try to practice mindfulness or meditation daily to have an emotional balance. Now, we have talked about the importance of mindfulness in our prior videos, so you can refer to those to understand better how you can do those mindful practices, such as simple breathing exercises can help you to manage your emotion better when you are taking steroids. And the number 2 is engage on light exercise like walking or yoga, which can help you manage your stress, as well as it can also help you get better sleep. And the number 3 is maintain a good sleep hygiene or sleep schedule so that you can get good sleep. Also, take your steroid in the morning so that you don't have those nighttime insomnia or a sleep problem when you are taking the steroids. So now let's go to the long-term side effects with the use of steroid. And there are 6 I have highlighted, including bone health issues, increased risk of infection, increased blood sugar causing diabetes, eye-related problem, skin health, and the heart health. Starting with the bone health, steroid can significantly weaken your bone if you stay on steroid for long term. And even it can increase the risk of osteoporosis, which is weakening of your bone. That can lead to increased risk of fractures. The second one, the increased risk of infection. Steroids or corticosteroids are immunosuppressive medication. They suppress your immune system, they weaken your immune system, and they cannot fight against infection. So your risk of infection is significantly higher. That's why we need to take precaution like vaccination and also doing the regular hand hygiene and other precautions that can minimize your risk of infection. But infection is a major risk with the use of steroid long term. The third one, increased blood sugar, even to the point that some of my RA warriors even get a new diagnosis of diabetes. That's because of increased blood sugar due to the corticosteroids. In the eye health, steroid can increase your risk of 2 particular problems. One is cataract and the next one is glaucoma, which is increased pressure in your eyes. So if you're taking steroid, watch out for those symptoms of cataract and the high pressure in your eyes. Many of our RA warriors who are on steroid, they complain that they get easy bruising. And that's because of weakening of your skin. It can cause thinning of your skin, it becomes very fragile and increase risk of bruising. And you might even notice slow wound healing, which is a common problem with the use of long-term steroids. Regarding the heart health, steroid can increase your blood pressure. Hence, watch out for your blood pressure if you have any of those problems when you are taking steroids. And some of you might also notice increased cholesterol. Now, we have talked about 6 long-term side effects with the use of steroids. So let's understand better how we can minimize those side effects. And starting with the bone health. So when you are on long-term steroid, it's very important for us to protect your bone. And you can do those 3 things that I have listed here that can help you protect your bone. The number 1 is taking adequate calcium and vitamin D. So check with your doctors to make sure they have checked your vitamin D level. If it is low, it needs to be supplemented. And taking extra vitamin D and calcium could help protect your bones. The next one is incorporating weight-bearing exercises that can put stress in your bone and that can help your bone stay stronger. If you have been on long-term steroid, it's very important for you to do regular bone scan called DEXA scan that can help you understand how weak are your bones. And if they are weak, there are certain medication that can be used to prevent future risk of fractures. The number 2 long-term side effects, the infection prevention. Now, the next thing we need to do to help you protect infection from the steroid. And there are 3 things that I have listed here. The first one is maintaining good hygiene and frequent hand washing. That can help you prevent infections. And if you know somebody who is sick, try to stay away from them or use masks to protect you from those infections. And always stay up to date with vaccines. The common vaccine include the pneumonia vaccine and then the flu vaccine that can help you reduce your risk of infections. Now, all of you rheumatoid arthritis warrior, if you're liking this video, please give us a thumbs up and subscribe to our channel for getting these type of information. Also, don't forget to accept our gift, the Holistic Rheumatoid Arthritis Guidebook, as well as the recipe of a smoothie that will help you fight against inflammation of rheumatoid arthritis so that you don't need all of these steroids. So to minimize skin-related side effects, I have listed 2 important tools. The first one is maintain a good skin care and routine protection of the skin from the sun. And when you're out in the sun, always try to use broad spectrum sunscreen that can help you protect your skin from the sun. As we have discussed earlier, steroid can increase your blood sugar, increasing your risk of diabetes. So close monitoring of your blood sugar is important. Your primary care doctor can help you monitor and also help you guide what to do in case of your blood sugar is high. This is much more important if you have diabetes and you are taking steroid, particularly the higher dose. And dietary changes can also help you manage your blood sugar better. We discussed about 2 important side effects related to the eye, the one being cataract and then glaucoma. So if you have any of those conditions, always follow up closely with your eye doctor to monitor for those side effects. Now, I know you might be worried about all of these side effects that I have mentioned earlier, the short-term side effects and then the long-term side effects. But you should not be stopping the prednisone because you are scared with those side effects. And the reason is stopping prednisone cold turkey can cause a significant problem in your body. And it can cause what we call adrenal crisis, particularly if you are taking prednisone for long term, particularly more than 2 weeks. If you are taking prednisone long term, always ask your doctor on how you can safely decrease your prednisone to minimize these side effects called adrenal crisis. And one of the main way of minimizing adrenal crisis is slowly decreasing your prednisone. And your doctor, your rheumatologist, your primary care doctor can help you guide on how to safely decrease your prednisone dose. As your doctor have prescribed your prednisone, you have an important role. First is understand the side effects and also clearly communicate those to your doctors. So always be open and honest with your symptoms and the side effect you are experiencing and get opinion from your doctors before you make any major changes. And if you feel you are having any new side effects, either related with the disease itself or due to steroid, always communicate clearly to your doctor so that they can help you manage those symptoms better. They will help you understand whether those symptoms are due to steroids or due to the disease itself. And always have some backup plan. Always talk with your doctors how to manage side effects that we discussed earlier. So ask them if you have any of those side effects, how do you effectively manage? And always be proactive. Understand those side effects and ask the questions when your doctor prescribes you those medications. Now, we have been talking about steroid a lot. We think the steroid are an important tool in your toolkit to help you manage your RA. But don't think that they are a trap. So use steroid as a tool, not as a trap. That's why knowing the side effects, being proactive is very important. And always openly communicate these things with your rheumatologist. So managing your RA is a partnership. The doctor is your coach, but you are the player. So try your best to understand the game, understand the side effects so that you can work together with your rheumatologist to make you feel better. In general, Now, managing RA is a true partnership between you and your rheumatologist. Thank you, all of you RA warriors. I hope this video helped you understand better about steroids and the side effects and how to proactively manage those side effects. Please don't forget to like and subscribe to our channel, and let us know in the comment if you want to learn anything else on rheumatoid arthritis. And I'll see you in the next video. Bye-bye.